The intended audience for the game I have created are second-year diagnostic medical sonography students currently enrolled in an Introduction to Vascular Sonography course. The content of this course includes hemodynamics, extracranial imaging, intracranial imaging, peripheral arterial and peripheral venous non-invasive vascular imaging. The game is entitled Duplex RS, and the activities seek to meet learning objectives designed to teach learners how to perform and interpret a lower extremity duplex examination. The learning objectives are: the learner will be able to identify lower extremity arterial anatomy. They will be able to demonstrate knowledge of a lower extremity scanning protocol. And they will also be able to identify normal versus abnormal waveform morphology within the arterial system. The game is based on constructivism and Keller's ARC model of motivation. The game opens with an interactive video that explains lower extremity anatomy along with the scanning protocol. Within the video, sonographers are asked a series of questions regarding anatomy, Doppler artifacts, and waveform morphology. So the learners are presented with a video, and then they're asked several different types of questions within the video to proceed through the video. So the first question here we have is identify the vessels that the common femoral artery bifurcates into. The answer for that is femoral and profunda. And then the learners will check, and if they get it correct, they'll be able to continue. And they'll also get their little star. Another type of question is written like this: name the Doppler artifact seen in the waveform. The correct answer for that is aliasing, and they get a little green bar with a little ding, and again, another badge or star. Here is a fill in the blank. Question, and we'll go ahead and type an answer in there. And see if that's correct. And it is correct, so again, we get awarded a star, and we're able to continue. One more type. In this type of question, we can just, it's a multiple choice. We can check, and again. So now we continue. The video concludes, and it gives you your score right here before we move on to the next activity. Videos are designed to, especially here at the beginning, I have it autoplay as soon as they start playing the module to try to gain their attention. The next section defines the lower extremity arterial duplex, the scanning position, and the actual scanning protocol. At the end of this, learners participate in a multiple choice quiz based upon the content of the text. So here it gives you the positioning, the scanning technique, what kind of transducer you use to actually do the test. And here are some graphics. And then here is a multiple choice quiz. So I'm going to go ahead and choose this. And then they'll move through the different questions. The next little activity is just a hotspot. This is where sonographers begin, up in the groin. And then when you click on it, it gives you some information about the particular vessel. And just kind of reinforces the content from above. This is just showing you this is a saphenous vein, and it's telling you that it's one of the first images, and it's also called the Mickey Mouse sign. Here's the femoral vein. And then the next activity we have is they have to drag the words into the correct scanning sequence of a lower extremity duplex exam. So just drag the words like this, and then they'll go ahead and check it, and they got 3 out of 3, so they get some feedback there. Tells them to go ahead and get a clinical competency. The final activity is a drag and drop exercise where learners are reassessed using previous knowledge from the other activities within the game. And these include identification of arterial vessels and waveforms that indicate proximal or distal stenosis within that particular segment of the vessel. So here we would just go ahead and drag and drop. I'm just going to do it real quick so that we can see how that works. Then we can move down here and we check it, and they got all of them correct. So then we go ahead and are propelled to move to the next page where we will get a scoreboard. And so we move up here. It gives you a summary. So they got a total score of 18 out of 18, which is excellent. And it gives you the scores individually here, depending on the activities within the game. You can also submit a report right here, and that will give it to the instructor. So anyway, that is my game. It was a lot of fun to create, and thank you very much for your attention.